So now on to our second publication discussion, which is a recent publication in the New England Journal of Medicine about the surgical or non-surgical approach to the care for patients with ruptured Achilles tendon. And we are really lucky to have Dr. William Granberry with us today, who is an associate professor at the Baylor College of Medicine and currently the acting chair of the Department of Orthopedics. Bill, thanks for joining us. Fascinating article. I am obviously fascinated by this because I had a ruptured Achilles and surgical repair. And also, I love a well-designed randomized controlled trial, particularly in surgery, which we don't see as much as we would like. So tell us about the trial. What were the design? What were the outcomes? And then maybe you and I could talk implications of this study.
Well, thanks for having me, Tom. You're right. This is a very ambitious and hard to do study in orthopedic surgery. They started out with a large number of patients and wanted to look at the differences between treatment outcomes for Achilles tendon ruptures. And they had three groups: non-operative or closed treatment, the standard open surgical repair, and the third group was a newer technique of minimal incision surgery. And so they ended up with about 170 patients in each group, and these were randomized, so that also aids in the understanding of the study. And the outcomes were patient-reported outcomes and physical ability and safety or complications. And they were measured more or less at a year after injury. And what they found was that there wasn't a great difference in the patient-reported outcomes. In fact, they were all the same.
Yeah, surprising.
The second, and with regard to muscular strength, there was not a statistical significantly difference, but looking at the results, there was a slight increase in strength for patients who had had surgery, especially the minimal incision surgery.
Right.
And with regard to safety, of course, the surgical outcomes had maybe some deep infections and some nerve injury. But the most obvious difference was the re-rupture rate, which was much higher in the non-operative treated group, but still very low.
You still have some re-rupture in the non-surgical group, not huge, but it is different. And then some infection and maybe nerve damage in the other group. Again, small. So interesting. And tell me, how does this change how you talk to your patients and tell your colleagues about this study? What is it? How's it going to change how you think?
Well, the debate about non-operative treatment for Achilles tendon ruptures has been ongoing among orthopedics for decades. But I think this study does show, and it's hard to argue, that there's really no difference in the patient-reported outcomes at a year. And so I think that orthopedists ought to give non-operative treatment a good look and offer it to their patients, especially if there's any comorbid factors, for example, especially smoking. And in those patients, it's certainly reasonable to offer non-operative treatment.
Well, very interesting study, well designed. I really enjoyed this conversation. I look forward to further discussions with you about this and truly appreciate you joining us for this discussion today. Thanks, Bill.
Okay, thank you, Tom.